Katie Marchischuk doing a subcut injection. It's February 7th, 2021 at 7:40. Just going to compare the physician orders to the MAR. So we have Jake Nursing, Finn 312, Finn 312, 654, 654, 987, 987, date of birth January 1st, date of birth January 1st, 1960, 1960. Doctor is Dr. Skills Lab and Dr. Skills Lab. They have no known allergies, but I'll ask at the bedside. Just checking if all the orders are transcribed and reviewed by 2 people, and they are, and the doctor has signed the doctor's order sheet, so that's good. So for scheduled medications, we have ondansetron, 6 milligrams, IM, daily before supper, and it's given at 1700 hours, and it's 7:40 right now, so we will not be giving that. Then we have heparin, 5,000 units, subcut, daily at 8 o'clock, and it's 7:40 right now, so we're within that half-hour time window, and it hasn't been given yet, so we will be giving that one. Also, just to note that the patient has been admitted for uncontrolled nausea and emesis secondary to chemotherapy. So we'll put the doctor's orders away, and then I'll wash my hands, and I'll select my medication. So it says heparin, so we have heparin here. It says it's given subcutaneously, and this says it's subcutaneous and also a single dose vial. So just to make sure that we can give this safely, I'm going to check the drug monograph here. So here we have heparin, and heparin says it can be given subcutaneously undiluted, which we are. The usual dose is 5,000 units subcutaneously every 8 to 12 hours. So our dose of 5,000 units is safe, and also it can be given by a student nurse. So that is good. So now that we know that is safe to give, I'm going to check for expiry date, and it says it's expired, but for the demo, I'm just going to pretend that it's not expired. And then to calculate my dose, so the dose is 5,000 units. So the vial says 5,000 units is 0.5 ml. So I'll be drawing up a volume of 0.5 ml. So that is good. I'm just going to look at my drug cards here. And so heparin, it's an anticoagulant, and it's used to treat emboli and blood clots. So that's good. So I'm just going to wash my hands, and I'm going to select my needles. So here we have a 3 cc syringe, a blunt fill needle, and then the needle I'm going to be using for this injection is a 27 gauge 1/2 inch needle. So I'm going to prepare my syringe. Throw that in the garbage. And then since this is a single use vial, I'm going to open the top, and then I'm going to clean in a circular motion for 30 seconds. So 30 seconds is up, and then I'll just let that dry. And while that is drying, I'm going to pull back and draw up 1/2 ml of air. So there we have it. And then, so that is dry now, and I'm going to inject the air into the vial, and then withdraw the medication. Just knock out any bubbles. Okay, and then I'm just going to push up to 1/2 ml, and I'll take this out and use the scoop method. I'll pull back on the plunger to make sure all the medication is within the in the syringe, and then I will open my needle, throw the blunt fill in the sharps container, and attach my subcut needle. And then I'm going to push up and calibrate to the correct dose. Just looking for any bubbles. And then push up on the plunger until I see a bleb. And there is a bleb there, and we are at 0.5 ml. So if you can just look at that, and I'll make my label. So Jake Nursing, drug is heparin. It's given subcutaneously. Dose is 5,000 units. The volume is 0.5 ml because the concentration is 5,000 units per 0.5 ml. Date is February 7th, 2021 at 7:40, and my initials is CMUMSN2. Okay, so now that I've done that, I'll do my second check. So here we have Jake Nursing, and then we have heparin. We have 5,000 units. The vial says 5,000 units is 0.5 ml. So here we have 5,000 units. 5,000 units is 0.5 ml, so 0.5 ml. And we have 0.5 ml. It is given subcutaneously. This says subcutaneous. Subcutaneous, that's a subcutaneous needle. It's given daily at 8 o'clock. It's 7:40 right now, so within that half-hour time window. It hasn't been given yet, so we'll give it. So since this is a single use, I'll put this in the med waste bin. Then I'll get ready to go to the bedside. So I have my needle, my label, my alcohol swab, my cotton puff gloves, and this will be a black pen. And then I will also take my drug cards and my MAR. And then we'll go to the bedside. So knock, knock. Hello, my name is Charity Marchischuk. I'm going to be your student nurse today. I'm just here to give you your heparin subcutaneous injection. As I'm walking in, I'm doing my entrance safety checks. I'm just making sure that the call bells near them, they're not in any distress. The bed or the side rails are up and the bed is in the lowest position, which it is. So I'm going to do hand hygiene, and then I'm going to compare the MAR to their wristband. So here we have Jake Nursing, and Jake Nursing, birthday is January 1st, 1960. Birthday is January 1st, 1960, and they have no known allergies. So I'll just ask them, can I have your name? Jake Nursing. Okay, and your date of birth? January 1st, 1960. Perfect. And do you have any allergies? No? Okay, so now that we've identified that we have the right patient, I'm just gonna do my last check. So here we have Jake Nursing, heparin, 5,000 units. So the vial said it was 5,000 units is 0.5 ml. So here we have a volume of 0.5 ml, and this is 0.5 ml. It's given subcutaneously. Subcutaneous is subcutaneous needle. It's given daily at 8 o'clock. It's 7:40 right now, so we're within that half-hour time window. It hasn't been given yet, so we will be giving it. So now that we're done that, I'm just going to tell the patient that I'm here to be giving them a subcutaneous injection. So that means that the needle is going to be going into their fatty tissue. So is that okay? Yes? Okay, so I will tell them that the drug I'm giving them is heparin. It's an anticoagulant. It's used to treat emboli and blood clots. So some side effects you might experience are bleeding or hemorrhaging and irritation to the injection site. So if you do, please let me know. Also, before I give this medication, I have already assessed for hypersensitivity as well as their APTT value. Also to note that this injection needs to go into the abdomen and to not massage the site, so we will not massage the site. I will also monitor their hepatic, cardiovascular, and renal status, as well as any abdominal or lumbar pain, as that can be an indication of bleeding. Just tell them that they need to report any signs of abnormal bleeding, so say nosebleeds or bruising, which is an indication of bleeding. Also to avoid smoking and alcohol, and to use an electric razor for hair removal, and as well as stay away from aspirin-containing products. And the therapeutic effect that I am looking for is improved blood flow or decreased clotting. So now that I have done that, I'm going to landmark the site. So the site I'm going to pick is the lower left abdomen, so 5 centimeters from the umbilicus in the fatty tissue. So I'll pinch an inch of fatty tissue, and I'll be going in at a 45-degree angle. So now that I've done that, I'm going to wash my hands and put on my gloves. And I'm going to clean the site. So I'll be going in a circular motion, moving out for 30 seconds, and then I'll let that dry. While that's drying, I'll I'll just prepare the needle here. So I will make sure that the bevel is pointed up, and then I will pinch 1 inch of tissue, dart in at a 45-degree angle, stabilize, push the medication in slowly, wait a couple seconds, take the needle out, and then let go of the pinch and put a cotton puff here and hold it for 30 seconds. And then while we're doing that, I'm going to activate the safety mechanism and throw it in the sharps container, but for now I'm just going to put it here. Okay, so now it's been 30 seconds. I will take that off, throw it in the garbage, remove my gloves, wash my hands. I'm going to sign my MAR. So I'm signing for heparin CMUMSN2. Heparin. Okay, so now that I've done that, I'm going to tell them that I will be monitoring them for any bleeding or bruising, as well as their hepatic, cardiovascular, and renal status, as well as their APTT value. And the therapeutic effect is that I'm looking for is improved blood flow or decreased clotting. So now that I have done that, I'm going to clean up the bedside. I'm going to do my exit safety check, make sure they're not in any distress, the bed is at the lowest position, call bell is near them, the side railings are up, and ask them if they need anything else. No? Okay, so then I did my exit safety check, left the room, and then I will write an IPN and document that, or I'll document their APTT value before I gave their heparin, as well as any signs of bleeding, which I didn't have, so I administered it. And also I will also continue to monitor their side effects.